Warm greetings to one and all. I am Shwetanjali, one of the fellows of WomenLift Health Journey 2024. I am working as CSR head for Siemens Healthineers India. Today, I am very excited to talk about my leadership project on cross-sector value partnership for preventing breast and cervical cancer in Kohima district of Nagaland, India. We are trying to understand how cross-value partnership is helping in early detection of breast and cervical cancer and what are the barriers and challenges for women in accessing breast and cervical cancer screening? Nagaland is one of the tribal states of India, and the indigenous inhabitants of Kohima district are Angami Nagas. In terms of disease burden, cancer ranks among the top 5 leading causes of death in the state. 1 in 72 women have the probability of developing cervical cancer, and 1 in 109 women have the probability of developing breast cancer in the state. However, only 0.3% women have undergone screening for breast and cervical cancer in the state. Healthcare access is a challenge. CSR allocation reveals concerning disparity. Northeastern states are extremely deprived of CSR funding, which has been time and again highlighted by several policymakers. Hence, to harness collective power and to create positive social impact, the three sectors have collaborated. Siemens Healthineers India, under the CSR initiative, have collaborated with Government of Nagaland and Doctors for You as the implementing agency. As part of this project, we are trying to understand how this partnership is adding value in early detection of cervical and breast cancer, and also trying to understand with the community what are the screening related challenges. For this, we interviewed key stakeholders from the three sectors as well as conducted focus group discussions with the community. Early findings suggest that from the public sector point of view, there is strengthened community outreach and awareness efforts, enhanced provider training and capacity building, screening in various remote areas have initiated, and improved patient navigation and referral, and also streamlining data entry in the NCT portal. These findings have been substantiated by the findings from the not-for-profit sector. From the private sector, other than CSR funding, there is technical assistance in terms of providing guidance with regards to tools, frameworks, supportive supervision, and also timely problem solving and troubleshooting. These are the few quotes from the several stakeholders. One of the CHOs said, "We received hands-on training for breast and cervical cancer for the first time in an elaborative way under this partnership." Another CHO said that the collaboration has helped us raise awareness about breast and cervical cancer in communities where these topics were rarely discussed, and involving self-help groups would be of much help. One of the state representatives said that it would be good to expand this program to other bordering districts. And one of the program officers for the project mentioned that before our intervention, the NCT focus was mainly on diabetes and hypertension, whereas now there is gradual shift to breast, oral, and cervical cancer. With regards to challenges with the community, their community think that they are healthy, why screening is required. There is uneasiness about the procedure, anxiety of pain and discomfort, and also fear of getting diagnosed with cancer. There is also question about need to travel long distances, which may impact their cultivation activities. In terms of recommendation, the community women suggested that they should be provided adequate information to make informed decisions, and they should be explained where to go and what next. As part of the learning, I gained self-awareness and started trusting my own abilities, created mutual value by leveraging each other's strengths and resources, give voice to diverse identities, which includes individual institutions, communities being key stakeholders, and also inspired to create gender equality for larger societal impact. At last, I would like to thank Women Lift Health team for providing this transformative experience. Thank you.